Surgical wounds. The mandatory questions on OASIS documentation talk about surgical wounds. A brief discussion on surgical wounds, inclusions and exclusions on surgical wounds is presented here for your reference before we move on to answering the OASIS questions. For the purpose of answering OASIS appropriately, we need to first know the surgical sites that are included and excluded for reporting as surgical wounds. Surgical sites included and reported as surgical wounds on OASIS. For the purpose of OASIS, report all wounds making an incision on the skin surface as surgical wounds. The edges of the surgical incision could be stapled, sutured, or glued. All surgical procedures conducted for insertion of any hardware like artificial joints, for implantation of any device like Mediport, for excision of any tumor, organ, or abscess are reported as surgical wounds. All Mediports and implanted infusion devices, whether or not regularly accessed, are reported as surgical wounds. They include medication pumps delivering nutrients, medications, blood products, or chemotherapy for patients. Pressure ulcer sites or other non-healing wound sites that were surgically closed will be reported as surgical wounds until epithelialized and healed. Surgical reversal of an ostomy creating a surgical incision on the skin surface is reported as a surgical wound, though the ostomy is not considered one. All centrally inserted venous catheters, tunneled or non-tunneled, will be reported as surgical wounds. As long as they are left in the body, fistulas and catheters used for hemodialysis and peritoneal dialysis are reported as surgical wounds, whether or not regularly accessed. All wounds that are considered surgical will continue in the same status for 30 days until after reepithelialization and closure, after which they are considered healed and not reported as current surgical wound anymore. Finally, any surgical incision with drain left in place will also be reported as surgical wound. It will remain a surgical wound even if the drain were removed, until 30 days after reepithelialization and closure, after which it is considered healed and not reported as current surgical wound anymore. Surgical sites excluded from reporting as surgical wounds on OASIS. All ostomies, such as gastrostomy, colostomy, ileostomy, cystostomy, urostomy, thoracostomy, tracheostomy, are excluded from reporting as surgical wounds. All peripherally inserted venous catheters, tunneled or non-tunneled, and all external devices infusing medication via a subcutaneous needle, are excluded from reporting as surgical wounds. Mere incision and drainage of an abscess site and general debridement of an infected traumatic wound are reported true to their original nature, as abscess or traumatic wounds. They are not reported as surgical wounds. Needle insertion and aspirations, such as thoracentesis and paracentesis, are not reported as surgical wounds. Mere toenail excision or removal is not reported as a surgical wound. Once any surgical wound site has epithelialized for 30 days and closed, it is considered healed and no longer represented as a current surgical wound on integumentary section of the OASIS.